The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, unstable neck bones put Aaron in danger of paralysis. Luca is injured in a playground fall. Sean comes to the ER with a cut forehead. And 7-month-old Jordan faces his second life-saving open heart surgery.
Fix him up so he can be good on his own.
Seven-month-old Jordan was diagnosed with a malformed heart 4 months before he was born.
Welcome back.
Same room, too.
Oh, really?
Yeah, it's the last time.
Exactly.
His parents had been worried that ultrasounds would show evidence of Holt or Ram's syndrome, a genetic condition his father was born with when the life-threatening heart condition was discovered. Jordan underwent the first phase of a 3-part surgical reconstruction when he was just 4 days old.
Did Dr. Bernard still do your first surgery too?
Yes.
Still, Jordan's oxygen levels drop so low he turns blue. Now that he is old enough, he must undergo the second phase of surgery, or he will not survive.
You could see as he was getting older and bigger, his energy levels slowly going down. There's a lack of oxygen, so he turns blue quicker in his jumper room. But he's good. He's very good natured. He's usually pretty happy.
There's a smile.
Jordan's parents take him to the OR waiting room for a final meeting with his cardiovascular surgeon. He has difficult news about the most recent MRI of Jordan's heart, which shows obstructed veins that may not be repairable.
So, we've stewed a bit over what we found, as you know. And the big issues are the pressures to the lungs are higher than what they should be. We have to get in there and deal with being too blue. And in order to deal with being too blue, we have to get more blood flow going to the lungs. If we can't get rid of the venous obstruction and we have to put a shunt in, then there's a possibility we're moving down what's called a palliative track, which means what we try to do is make your child as comfortable as possible and what life they do have be as reasonable as possible. And I don't know the answer to that. I think, this clearly is a situation where we don't have a great solution. All right? I think it's going to be a long day. It's going to take a while to do all of this. I'm going to need you to cool your baby down again, very cold, stop the circulation for a while to do some of this. I won't have to stop it for all of the operation, but I'll need to stop it for some of it, at least the part I'm working on the veins, most likely. And then there's just a lot to do, so it'll take a while. And like I probably told you before, I can't promise you what's going to happen, but we'll make intelligent decisions and do accurate work. Use a rational, disciplined approach to taking care of your baby, and we need some help.
Thank you.
Any other questions?
Good luck.
I don't think so.
All right. I'll see you in a few hours.
Jordan's open heart surgery is minutes away. 10-year-old Aaron Iredale was born with an undiagnosed type of skeletal dysplasia, a condition that has prevented her bones from developing normally and limited her growth.
Good job.
The vertebrae in her neck are so unstable that 3 months ago, a backyard fall caused Aaron to become temporarily paralyzed.
Hold nice and still. We're all finished.
Today, Aaron prepares for surgery to fuse the bones in her neck so she can avoid the threat of permanent paralysis.
Hello.
Hi there.
How are you doing?
Good.
Good. How's everything going?
Going good.
That's going good. Good. And how's your neck and your back and everything doing?
Oh, it's doing good.
It's doing good. Great. Since that other episode where you've had that little episode falling down, have you had anything else happen to you?
No, nothing like that. The only thing that she's ever complained about is really her left leg. The odd time we'll feel like it's fallen asleep when she's been sitting. Then I tell her, that happens to all of us sometimes.
Let's take a look at you. Can you stand up? Now, can you put your hands out in front of you? And let's see you bend forward. Try and touch your toes. Good. I'm just going to take a look at your back. So you can see, where the prominence in her back is. There's a little bit of a curve to it. And let me see, can you stand up on your tippy toes for me? I'll do it with you. No problem doing any of that. I'm going to have you sit down for just a minute. Don't sit on your brother. You can sit next to him. Do you want to take a look at your x-rays?
Okay.
Okay. Let's see if we can get them up on this machine here. Let's take a look. We'll take a look at the x-rays of your neck first. So here's the x-rays of your neck. This is your head and your neck from your side. You can see. And actually, when you're in this position, the alignment actually looks really good. And here's what I'm concerned about. When you bend forward, you can see there's actually a big change in how this bone moves forward like that. I'll just show you again when you come from the back. It's sort of way in this position, and when you bend forward, it moves quite a bit forward.
Yeah.
And in here is where the nerves in the back go, and you can imagine how this bone moving forward could put some pressure on your nerves inside your back and potentially cause you trouble. That's where the problem is in your neck. And the real reason to do this is not so much because of the problem with your neck now, but because of that injury that you had, that was giving us a warning sign. And if you injure yourself, maybe there's something bad to the nerves that go from your brain down to your legs, and you don't want that to happen permanently, right? And that's the reason to do it.
That's right. Any other questions?
Don't think so.
No.
Okay?
Okay.
Okay.
Okay, bye-bye.
Bye.
Surgery to stabilize Aaron's neck is 1 month away.
See you in a month.
3 hours ago, 11-month-old Sean took a nasty fall.
Here, and hit his head on a toy. Okay. He fell. I think he fell. I had my back to him, but he fell, I think, about a foot.
His family doctor has sent him to the hospital's emergency room for stitches.
So what happened?
He fell and landed headfirst on a bunch of toys and got a cut. I think it's like a puncture.
Okay.
Went right in the middle of his forehead.
That was today?
Yeah, it started about 10:15 this morning.
And you could just have a little peek.
It's bleeding like nobody's
Oh,
business.
it's bleeding a lot?
Yeah. We went up to Dr. Bender's office, and she took a look and said it needed to come down here because it was too deep for the butterfly sutures.
Okay. So what we're going to do is we're going to put on some cream that will help to freeze it. And it takes about 20 minutes to work. And then once that takes effect, we'll put in a little bit of extra freezing. And the freezing will make all the pain better. And it may help with all the bleeding as well.
Okay.
And then we'll do some stitching. We'll just hold him and he'll cry, but we'll just try to be quick about it and get it done, and that way when we're done, at least he doesn't have to recover from anesthesia and he can just go home after.
Okay.
We'll see you shortly.
Okay, thanks.
I'm going to get you to do. I'm just going to peel it off. Peel that Band-Aid off.
Sometimes it stings a little bit when you first put it on.
Okay.
Okay, and I'm going to put a Band-Aid over it.
Please
So I want his
stay
head
with
right
the
back because I don't want this to drip into his eyes at all. So.
Okay. Here we go, sweetie pie.
An anesthetic cream will numb the area around Sean's cut. As soon as it takes effect, Sean will be given an injection to freeze the tissue so his cut can be stitched.
I'll just give you a little bit of gauze and I'll get you.
Thanks.
It's time for 7-month-old Jordan to be taken into the OR for open heart surgery.
The sooner we go, the sooner we don't. Oh, do not cry. Crying is most emphatically not allowed. Come on, let's go look. Oh, sweetie.
News that the surgery may only temporarily prolong Jordan's young life makes saying goodbye even more difficult for his parents.
Dr. Benhart is a professional. He's going to take good care of him.
While anesthesia prepares Jordan for the operation, his cardiovascular surgeon reviews the particular problems Jordan's case presents.
Well, the issues with baby Jordan are that there's a single ventricle, but compounding that is that there's an abnormality to the veins that drain the lungs. Those items go together sometimes, and they're not usually associated with a very good outcome. If we can get rid of that obstruction to a satisfactory extent, then we'll proceed with a stage 2 operation. If we can't get rid of it to a satisfactory extent, then we're left in a situation where we're really just doing palliation. And palliation means how can we make Jordan pink enough so that Jordan's comfortable, because right now we're getting too blue.
Jordan has been anesthetized, and his surgery can begin.
No, when you get a chance, can you flip through the MRI and get it up to the one that shows the veins?
The team's first job is to open Jordan's chest and saw through his sternum to expose his heart. Already, Jordan's surgeon is running into complications. Scarring from Jordan's first surgery has caused his heart to adhere to his chest wall.
So his heart's completely stuck to his chest wall, which means that we need to go on bypass before we open up his chest. So we'll get set up to do that. I'm going to have to go on through neck cannulation, you guys.
Continuing to open Jordan's chest would cause him to bleed to death, so the surgical plan must change.
Carotid.
Jordan's surgeon will open an artery in his neck and put his circulatory system on the heart-lung bypass machine to empty his body of blood before trying to open his chest a second time. But this procedure comes with new risks. Air could get into Jordan's circulatory system and cause a stroke. It's been 3 anxious hours since 7-month-old Jordan was taken to the OR for open heart surgery. Jordan is now on the heart-lung bypass machine, and his surgeons have safely opened his chest without damage to his heart. But now, the team faces an even greater challenge. MRIs of Jordan's heart show obstructed veins that may be inaccessible for repair. If that is the case, the goal of the surgery will change from life-saving to palliative.
It's just as I thought. There's the PAs between the confluence and the heart. That's the fundamental issue.
This is the one where the left veins drain, we thought adjacent to the coronary side.
Here's PA. Here's LSVC. And yeah, there's no way to make the orifice bigger.
You gotta go around the...
You have to go anterior to the PA. So the left aren't obstructed. So there it goes behind the trachea, I think. That's where the obstruction is. It feels like it's behind the trachea. I'll look for it behind there. I may be able to make some kind of connection there. Yeah, no, I remember it clearly. On the MRI, it looks like you could just open it up and you'd be there, but when you get in here, it doesn't seem that way. Hey, maybe we got something. You called it, Reddington. Good, thank you guys. Appreciate it. Maris.
It has taken the combined experience of 2 cardiovascular surgeons and a cardiologist, but they have come up with a plan to repair Jordan's obstructed veins.
How long have we been circ arrest, total circ arrest time?
12 minutes.
But in the beginning too?
They will spend the next hours trying to make that plan a reality and save Jordan's life.
Let's figure out how we're going to do this.
11-month-old Sean has had numbing cream applied to his cut forehead.
His head up here. No, I'll get you to get out all that.
Now, he needs an injection to freeze the tissue.
There we go. Now we're gonna wrap you up like a bunny.
What's over there?
The ER's child life specialist will try to distract Sean from the pain.
There they are. Little mosquito bite. Good job, Sean. Little Gio.
There you go, sweetie pie.
Bubble.
Yeah, I know. It's a little stain. It's okay, honey bunch. It's okay. Little
Good job, Sean.
Sean, I'm right here. Yeah, I know. It's okay, sweetie.
Almost done. That's it. Almost.
You're doing so well, Sean.
Good job.
More washing. Washing.
Ooh, that's a funny looking one.
Brown soap.
Yeah.
You just put it straight up.
That's it. What do you want? Towel.
Now that the freezing is in, Sean's doctor will stitch up his cut.
That's the coolest needle.
Good job.
Sweetie. Oh, Sean, you were doing very well, sweetie pie. Yeah, you're doing very well. What do you think Stephen and Christopher are doing right now, sweetie?
How old are they?
Stephen's 5 and Chris is 3. That's pretty impressive there, Sean.
Yeah.
Almost
Boy,
done.
He was fantastic.
He was great.
Do you see
looks
those
pretty good.
bubbles?
Yeah, it looks great. It's beautiful.
Sean,
Okay,
you
we'll
were
just
so
get some
good.
polysporin.
There we go. That's it.
And then we'll just get a little Band-Aid.
Bandage, get stuck to your head.
Mm-hmm. Your hair's a little brown now, but good.
All done.
Excellent.
Now that Sean's cut has been stitched, he's ready for discharge.
Good job, Sean.
He was very good.
I'm amazed,
So
actually.
are
We all are.
He will have his stitches removed by his family doctor in 5 days.
Use a bear a whole lot, so you might as well.
That's okay. Goodness. Oh my goodness.
It's been difficult, but 7-month-old Jordan's parents try to be patient as they move into the 7th hour since his heart surgery began. It's been a challenging operation, but the team of surgeons has managed to complete the second of the 3 phases of surgery Jordan needs to save his life.
Just stay right there. I want to put another stitch in.
But before they close, the surgeons check their work by using an echocardiogram to assess Jordan's heart function.
It's fine.
Well, you can see the SVC junction where the original veins drained in.
Well, the pulmonary veins drain very nicely. There's no obstruction.
Okay.
That's what we want
You
to
see all 4.
All 4, absolutely.
All right. Thank you.
Okay.
I appreciate it. The echo looks fine. The heart's working well. The repair we did seems to be okay. You can't see all of it, but the veins part, which is a crucial part, seems to be all right. So I think it'll be okay. Obviously, the biggest thing we're worried about is how's his head going to be after having to stop his circulation for so long and having the problems with the entry into the chest where air gets into the closed circuit system. But we've taken a lot of precautions in that regard, and you just hope for the best.
The team will now close, and the surgery will be complete.
Hello. Things are okay. A bit of a challenge, and maybe even more than what we'd anticipated. But in the end, what we wound up with was with veins that seemed to be unobstructed.
Okay.
The first challenge we had, and it doesn't happen very often, but we weren't even able to get in the chest without getting into the heart, and so we went on the heart lung machine through the neck. Okay. You'll see when you see him, the incision used to start down here. Now it starts up in the neck because we had to open it up further. Okay. We were on the heart lung machine a long time. My only kind of concern, and I just don't know the answer to this, is how's Jordan's brain going to be?
Okay.
And when you have these issues of having trouble getting in, we know that air got into the body circuit. The body circulation is a closed circuit, and we open it in a very controlled environment normally, and then we can get the air out of it to minimize the risk of stroke. When you open the chest, and can't get in the chest without opening that circuit, it's not as controlled. And there are a lot of things we do for precautions in that regard, and we did a lot of precautionary things to try to protect his brain as much as possible. But until, we don't know for sure until he wakes up how his brain's going to be. And I know for sure that there was air in the circuit because we could see air in the closed circuit from this. It's not that we haven't seen this before. We've seen this before and kids have been okay. We've seen this before and seen problems. I don't know what it's going to be. A stroke.
A stroke.
A stroke. That's what we're... So hopefully it'll all be okay. But we'll have to wait until he wakes up and see.
Okay.
Right. Any other questions?
I'm sure I'll think of some later. But
You look like you're about to pass out. You gonna be okay?
Oh yeah.
You need to lay down?
Yeah, maybe you
lay
should.
Down.
Yeah.
I'll come back.
Jordan's chest has been closed, and he is transferred from the operating room to the critical care unit. After a long and difficult day, Jordan's parents can finally see him again.
So, and I know you've seen him from previous surgeries, so now.
Just have to go up a little higher.
Jordan will remain sedated and on life support for several days until his heart function is more stable. Until he wakes up, Jordan's parents will not know if he has had a stroke during surgery.
Do you see the sign there? 5AB admission unit? That's where we got it.
10-year-old Aaron was born with an undiagnosed type of skeletal dysplasia and needs surgery to fuse her unstable neck bones to end her risk of paralysis. Her parents take her to the OR waiting room for a final meeting with her surgeon.
Yeah.
Hi, how are you doing? Actually, can you stand up for me? Let me just take a quick look at your back. So, for the operation, first we'll make the incision, we'll expose the back of the spine.
Mm-hmm.
We're going to try and use these screws and rods to hold the spine into a straight position near the top. Because she does have abnormal bones, there always is a possibility we might have trouble getting the screws in some of the levels.
Right.
I don't think we will, but there always is a possibility.
Yeah.
If we can't get the screws and the plate in safely, we won't use it because we don't want to do something that's going to be dangerous for her. But I think we'll be able to get this in, and we actually have a special one we've ordered in that allows us to be very, very flexible. We've already put the screws so we can be a little bit inventive and put the screws in places that normally wouldn't go into it someone who had a full-grown size spine. The main risk for this operation, the thing that I worry about the most and everyone's going to worry about the most, is damage to the nerves in the back. And even though I know she can move her head all over the place and it doesn't cause her trouble, she had this episode where she had this injury and she had this, and temporarily was paralyzed. And under anesthesia, because she loses her own muscle control, there's always a chance that if we're not careful, we could put her neck into a position that could cause trouble. And that's why I was so worried about making sure we have all the neuromonitoring available for the operation so we can check that and prevent that from happening. Do you have any questions for me about all this?
No, I think
Are you sure?
everything, eh? You okay? No questions? Okay.
So I'm going to go put on green clothes like everybody else has on, and I will see you in a little bit, and I'll see you guys probably in the afternoon.
Okay.
Okay?
All right.
Okay, great.
Thanks. Bye.
It's time for Erin to be taken into the operating room for her anesthesia.
Say bye to Mom and Dad. See ya. Give them a big hug.
Oh, and your brother, too.
Let's go down. Can you have a nice long sleep, okay, sweetie? Come this way. All right, we're gonna go around the corner. Say excuse me. All right. This is Erin. It's okay.
Since you didn't choose watermelon, I'm going to give you extra bubble gum. And that.
Once Erin is asleep and her breathing tube is inserted, surgery to fuse her neck bones will begin.
You have nice dreams. Tell us all about your dreams when you wake up.
It's been a rough 15 hours since Jordan came out of the operating room. During the night, his heart began to swell. Surgeons reopened his chest to give it room to function.
How are you?
Good. So, things are quite a bit better this morning as compared to when we talked in the middle of the night. As you know, we opened because there just wasn't enough room for the heart, and things steadily got better once the heart had more room. And clearly some swelling had taken place, which is pretty common when you're on a heart-lung machine for a long time like that, and when you have to stop the heart that long. So what we're doing today is really just kind of balancing everything out. Where we don't need quite as much support for the heart, we're backing off on that. And we'll probably try to take some of the ventilation support off. We'll still be on the breathing machine, but we'll just back down on the amount we're using. And really just kind of wait. Now the body's going through whatever it goes through, gradually healing and adjusting to what we did. And then hopefully over the next 2 or 3 days, we'll see kind of the body swelling start to subside. Then we can close the chest back up and it should be fine. All right, well, I'm satisfied. I'd rather we'd not have that dip, but it's part of doing this kind of surgery sometimes. So, step by step. Thank you.
Thank you very much.
Jordan's chest will remain open until the swelling in his heart subsides. It's been 2 hours since 10-year-old Erin was taken to the operating room for her neck surgery. It has taken all that time to safely position Erin's neck so the surgery doesn't cause paralysis while the team works to prevent it.
And now that we've done all this work, now we can start the operation.
The surgeon's first job is to open Erin's neck to expose the top 3 vertebrae. Once the vertebrae are exposed, they will stabilize the bones using a metal plate.
In the middle.
This is the plate system we're going to use for holding the spine straight. This part will have screws in it that will go into the skull to hold the top of the heads in place. And these are adjustable along the rod. And we're going to put a screw in here, into this end, and we'll go into the vertebral body. So these screws will hold on to the vertebral body, and so this is the part that will go into the skull.
Surgeons must be careful not to damage Erin's spinal column as the metal plate is screwed into her vertebrae. One week after his open heart surgery, 7-month-old Jordan remains in the critical care unit, sedated and using a ventilator to breathe.
The first couple of days were quite rocky. He had a lot of ups and downs, but he's doing a lot better now. They finally closed his chest yesterday. Because he's paralyzed right now, so he doesn't move. They're going to wean that today. So I think he had his last dose maybe 20 minutes ago, and then that's going to be it, and see how well he tolerates it.
But it's still long. Very long. It's been a week now. He's been asleep and sedated, so it's definitely getting along.
It has been a long week for Jordan's parents, and until Jordan is awake, they will continue to worry that he may have had a stroke in the operating room. 10-year-old Erin's parents have been waiting for 4 hours for news from the OR. A metal rod has been fixed to her unstable vertebrae to keep her neck in a good position. Now, donated bone graft is packed in so that over time, her vertebrae will heal as one solid bone.
Yeah, that's great. Okay, we're putting the bone graft around all over the area we did surgery. And hopefully this is all going to turn to new bone and fuse in place for her. Can you get some more in or no? Probably not.
Once Erin's neck is closed, her surgery will be complete.
Hello. Everything went absolutely perfect. Okay. No problem at all. She's actually just being wheeled into the recovery room, and she did really great. We were able to get the hardware in place, and it looks pretty good, secure fixation. So everything went really well. She's awake. She wiggles all her toes and everything. There's no problems with the nerves. Again, we used the plate with the rod on it, and it's bolted into 2 of the vertebrae on each side.
Well, thank you so much.
No problem. Yep.
I'll give you a hug after all that.
Okay.
Thank you.
There you go.
Thank you.
Okay.
Come on, sweetie. You need a warm weather. Come on over. Hi.
Erin has been moved to the recovery room. She is already awake.
Oh, goodbye. You made it, honey. Yes, you look great.
Erin is doing very well just minutes after leaving the OR.
But for us, she's been fabulous. There's no concerns.
But recovery from spinal surgery is especially painful.
Great, honey, and it's over.
The next 3 days will be difficult ones for Erin.
We'll stay with you.
Seven-year-old Luca has come to the hospital's emergency room after cutting his mouth in a playground fall.
Hi there.
He has been referred to the plastic surgeon on call.
Department here. So Luca, I'm gonna have a look inside your mouth. Okay, it's not gonna be painful, and if you feel any pain, let me know. You just sit back. Good. Careful with the light here. Okay. Good. Can you close your mouth? Can you feel me touching you there? Can you feel me same as here? Different?
Yeah, this is a little bit like painful, and this isn't.
Okay. First, I'm gonna give you this little injection around the area where it's cut. It's gonna hurt a little bit. Okay, it's gonna feel like a thin prick and then like a bee sting for a few seconds, and that's it.
Injecting local anesthetic into the cut may be the worst part of Luca's treatment.
But just for a second, stay brave. This is the
Just
only
try.
thing.
Just let's try.
And stay calm. As soon as it.
Ouch, ouch.
That's it. Look, now we're counting. 1,
Luca will need 3 injections to freeze his cut.
4.
It's been 1 day since 10-year-old Erin's neck surgery. She has moved from the critical care unit to the orthopedic ward.
Are you comfortable now? You look good. I know you don't feel so good, but you look good. They said you're doing really great.
Surgically, Erin is doing well. But she knows from previous experience how difficult recovery can be. The next 2 days will be tough for her. Two weeks after Jordan's open heart surgery, he remains in the critical care unit on a breathing machine. But he is now awake and shows no signs of a stroke.
One step closer, bud. It's been 2 weeks we've been in here. Cardiac-wise, he's doing fine. He's got secretions in his lungs, so that's why they keep suctioning him. He's not happy, Definitely wants that tube out of his face. So this week has been his first where he could actually see us and hear us, but sometimes it makes it worse because he sits there and stares at you. Usually he knows us as his protectors, right? And he's always like, well, how come you guys are letting this happen to me, you know? And he sits there just staring at you with these sad big blue eyes.
Jordan's recovery from heart surgery has been full of ups and downs. But if all goes well, he won't need to be on the breathing tube much longer.
Yeah, he has quite a bit, and he needs more now.
It's been 10 minutes since 7-year-old Luca had to endure 3 painful injections to freeze his cut lip. The anesthetic has taken effect, and Luca's plastic surgeon now stitches it.
Alright. Is he gonna do the stitches now?
Yep, soon.
Probably 5 minutes.
Right now.
Open.
Okay, so let's keep your. There you go, nice and still. You should. That's it, nice and still, buddy. I know it feels weird. Try and keep your mouth as still as possible. There, you did it. Good job. Great.
Are we done?
Almost. Just that you chew inside and...
Taking a look. Great. Good job.
When can we play hockey?
When can you play your hockey? When is your next practice?
On Saturday.
You should be able to play, but you shouldn't shout. Can you play without shouting? Yeah?
Thank you.
Luca, thank you very much. That was great. Sorry if I give you any pain. But it's okay now, right? No pain now. Okay? Thank you very much.
Thank you so
okay?
much.
Thank you. Thank you, Michelle.
Luca is now ready for discharge. He will be followed by plastic surgery in case he develops a complication like infection. 19 days after his open heart surgery, 7-month-old Jordan is breathing on his own. He no longer needs the support of the critical care unit.
Just get to look around finally. No, I'm moving.
He's been extubated, and now we just moved up to the 4th floor step-down unit, which is a much better place to be in this hospital instead of critical care. So this means we're halfway there. Too fabulous.
Hello.
Is that better?
3 days after her spine surgery, 10-year-old Erin has made it through the most painful part of her recovery.
Good sitting up like that.
Turned around a little because, you know, I got to readjust now, don't we?
So I've heard you've been up walking around.
Yeah.
Is that right? And you are eating okay?
Yeah.
Yep. And you're feeling pretty good?
Yeah.
Except you feel some noises every once in a while in your neck?
Yeah.
Yeah, that's
It's
normal.
really weird.
Yeah, that's normal. It's a little bit from some of the soft tissue settling around in that area. Don't worry about that at all.
Yeah.
You're doing pretty well. You know, like I told you before, the hardware that we did for the surgery holds your head really good for moving backwards, it's rotating side to side and tilting side to side. The only time I think you can cause trouble is if you really bend forward a lot. So I don't think you need to be really, really super scared about doing things. But I think you just should avoid bending forward. Well, I'll let you know after the x-rays are done how they're looking. Anything else?
Not really.
Okay, bye-bye.
Bye.
Erin is doing extremely well after her massive spine surgery. But now, Erin must face the moment she has been dreading most about the whole procedure. Erin undergoes x-rays to determine if she will spend the next 6 weeks in a body cast. 1 month after his open heart surgery, Jordan is ready for discharge.
He has a blood infection. They had to put in a PICC line in his arm, which is this right here, to give him antibiotics for 6 weeks. So he has 4 weeks remaining, and a home care nurse has to come in the home and actually administer the drugs through his PICC line. And the next time we see his cardiologist is in 3 months, and they just follow him closely and sort of see how he's doing and I guess assess it from there. Okay, bye guys.
Bye.
Bye.
Jordan will undergo an echocardiogram when he returns in 3 months to assess his heart function. Only then can his parents be assured that the surgery has been a success and that the worst is over for Jordan. Five days after her neck surgery, 10-year-old Erin has made it through the most painful part of her recovery. Her x-rays look good, so Erin will not have to endure 6 weeks in a body cast.
This morning, we had very good news that we were going home today, and we were really very excited about it.
It will take up to a year before Erin's neck completely fuses, but she has had a remarkable recovery from her massive surgery.
Yeah, thank you. Are we ready? Yes.
And in just 4 months, Erin is able to have fun with her friends without worrying about the threat of paralysis.
She's having a great time. Good start to the summer for sure. Oh, she's practically back to normal.
I'm enjoying going back to school and playing water fights.
Two months after 7-year-old Luca's playground accident, his cut lip has fully healed. A trip to the ER has not slowed Luca down. He continues to be a daredevil. And 8 weeks after a visit to the ER, Sean is a daredevil in the making.
Back to his normal self, and no concept of danger, and into everything. What else did you find?
Ducky!
Oh, the duck. There's
Quack,
the duck,
quack,
Sean.
quack, quack. Oh, yes.
Do you hear that? Is that your duck?
3 months after Jordan was discharged, he returns for an echocardiogram to assess how his heart is functioning. Jordan's parents see his cardiologist, who delivers the results.
How's his color been?
Good.
So the echo was good. His heart function was good. They couldn't look at his veins because he woke up before the study was
even started.
Okay. Could I have a listen to your heart? Would you mind, huh, Tiger? It's much safer with Mommy. His heart sounds good. Next, all the other noises that I was listening. Okay, he looks great. Very, very good. It's gone through a lot. Very bumpy road. Big hard parts over.